What is bloody diarrhea? Causes and treatment of bloody diarrhea. Diarrhea or loose motion is a condition in which the body loses fluids due to intestinal malabsorption. The term acute diarrhea indicates passing loose stools 3 or more times a day, for a period lasting no longer than 14 days. Superscript 1. In addition to the changes in stool frequency and consistency, other symptoms of diarrhea include abdominal pain, fever, bloating, nausea, and blood in the stool. Diarrheal diseases can be divided into 3 categories: acute watery diarrhea, acute bloody diarrhea, or persistent diarrhea, lasts at least 14 days. All of which are conditions that require immediate treatment. Known as bloody diarrhea, this condition in which blood accompanies loose and watery stools can pose critical health effects and often signifies life-threatening disorders. It can be either acute or persistent, meaning it can last less or more than 14 days. Here are common symptoms and causes of bloody diarrhea and how to treat it. Before going into the video, discover the forgotten power of plants, the Home Remedies Handbook. You'll find 800+ beneficial plants and remedies in the lost book of herbal remedies. It includes recipes of tinctures, teas, decoctions, essential oils, syrups, salves, poultices, infusions, and many other natural remedies that all of our grandparents used for centuries. What's also special about this book is that it has between 2 and 4 high-definition, color pictures for each plant, and detailed identification guidelines to make sure you've got the right plant. So make sure to check the first link in our description to get the book. Now let's get into today's video. Bloody diarrhea symptoms. Other symptoms that may occur with bloody diarrhea vary in relation to underlying conditions or diseases. In addition to rectal bleeding, signs of bloody diarrhea include abdominal pain or cramping, body aches, fecal incontinence, fatigue, abdominal swelling or bloating, rectal pain, mucus or undigested food, nausea or vomiting. Causes of bloody diarrhea. Bloody diarrhea often results from gastrointestinal bleeding, which can happen due to a specific injury or disease. Hematochezia is the term used to describe diarrhea that contains bright red or maroon blood, an infection of the intestines resulting in severe diarrhea with the presence of blood and mucus in the feces. This condition can occur at any age, and its duration depends on its cause, which is challenging to uncover in some cases. Here are some of the reasons behind the occurrence of bloody diarrhea. Rotavirus. Bloody diarrhea is one of the most common symptoms of rotavirus and is often referred to as stomach flu or stomach bug sometimes. It is the most prevalent cause of diarrhea in children under the age of 5. Rotavirus symptoms include vomiting, fever, abdominal pain, acute watery diarrhea for 3 to 7 days, and gastrointestinal bleeding. Hemorrhoids. Like varicose veins in the legs, hemorrhoids are swollen blood vessels in the anus and rectum from increased pressure. It can occur internally or externally, leading to rectal bleeding. The actual cause of bleeding is usually not identified, but it happens in correlation to diarrhea, constipation, sitting or standing for a prolonged period in pregnancy. Anal fissures. Red diarrhea can result from skin inflammation in the lining of the anus, which may lead to tears in that area. These tears can result in a small amount of blood in the stool, less than most other sources of bloody diarrhea. Proctitis. This is an inflammation in the skin around the rectum area, which can result from previous radiation therapy for cancer, infections, medications, or a form of inflammatory bowel disease. Its symptoms include frequent urge to have a bowel movement, rectal bleeding, and pain in the anus and rectum area. E. coli infection. E. coli is a bacterium that causes symptoms of diarrhea, including blood in the stool. Most E. coli infections are associated with eating undercooked beef, eating food infected with animal feces, or drinking raw milk. A side effect of medication and other conditions. Some medication can disturb bacteria in the stomach or cause gastrointestinal bleeding, leading to bloody diarrhea in some cases. Other conditions that can cause bloody diarrhea are inflammatory bowel disease, stomach ulcers, diverticulosis, and constipation. Treating acute diarrhea, antidiarrheal medicines. In mild and acute diarrheal disease cases, antidiarrheal medications can help reduce the frequency of bowel movements. These are safe if no fever or bloody stools are co-occurring with diarrhea, in which case professional medical advice is required. Imodium contains the active ingredient loperamide and is available over the counter without a prescription. It helps calm the intestines to restore the normal functions and movement of the digestive system. Imodium brings back the rhythm to your body by allowing it to start absorbing nutrients, fluids, and salts as it should. If you like the video, then make sure to hit that like button. Also, if you want more natural remedies, health guides, information, then make sure to subscribe to our channel. Let me know what you think of this video in the comments, and thank you for watching. And please consider subscribing our channel for more health content every day.